Hi, I'm Marvin Plackett, and today is Monday, April 6th. Good afternoon to all residents, staff, guests, family members, the whole world. I want to first do a shout out to Nell. Nell wrote a very nice card to me, and Nell, I appreciate that, thanking me for my leadership. As you all know, though, the people that are really doing the hard work, the really important work, are the ones providing the direct care, the nursing assistants, the nurses, those that are assisting with the most intimate things, those that are working really in close proximity to one another, and that's all part of the job. Those are the ones that are most deserving, of course, of acknowledgement from everyone. So I appreciate Nell, the note to me. I appreciate that greatly, but to all of you, I know that you know, and I encourage you to take the opportunity to acknowledge and maybe write a note, say some words of thanks to those who are providing the direct care, because they're truly the heroes. They've been called that many times by many different leaders. Those that are on the front lines of first responders, in the hospitals, in long-term care organizations like ours, those are the heroes. They are right on the front line, and that's the majority of our staff here at Episcopal Homes. I'm pleased to once again report that we have no COVID-19 cases, no confirmed COVID-19 cases on our campus. There are none at Episcopal Church Home. There were some people that were on watch. There are none at the gardens. There were some people that are on watch. There is still one staff person who is not yet scheduled to work while he's fulfilling his 14 days in isolation. And there were two residents that were on watch in isolation. At the terrace, they no longer are in isolation because they have fulfilled their full 14 days. So very pleased that that continues to be the case. And again, that is in large part due to everybody's vigilance, your vigilance. Face masks. So over the weekend, I know that you saw a lot of information about wearing face masks, and some of it was not always consistent. The messaging was not always consistent. What we are going to do is we at Episcopal Homes, we follow the organization that has the strictest guidelines. That's been our practice. And we've consistently been just one step ahead of a lot of the organizations or individuals that are speaking up on these matters, and I'm pleased about that. I'm proud of that. So starting today, in accordance with direction from the Centers for Disease Control, CDC, and from the Center for Medicare and Medicaid Services, CMS, Episcopal Homes is requiring all staff to wear a mask at all times to reduce the chance of infecting others. These masks will often be homemade cloth masks, and we are strongly encouraging residents to follow suit, to do the same, to wear a mask anytime you are outside of your unit. Homemade face masks are not considered PPE, or personal protective equipment. Staff use PPE when they are working with someone in isolation while we await test confirmation, or should we one day have a case at Episcopal Homes. To residents, we are diligently working to increase our supply of homemade masks. In the meantime, we encourage you to seek ways to obtain or create masks. The U.S. Surgeon General recommends using a 20-inch by 20-inch piece of t-shirt or other material like a handkerchief. To view mask design details, please visit our Episcopal Homes website, COVID-19 page, and then go to Ways You Can Help page, which is found under the COVID-19 page of our Episcopal Homes website, and that is episcopalhomes.org. Masks for staff can be found at each of the 3 entrances. For cleaning and sanitizing homemade masks, the Minnesota Department of Health recommends washing the masks in hot water and put the dryer on the hot cycle. So again, hot water, hot cycle. And using regular laundry soap. The wearing of a mask does not reduce the need for social distancing. This is just one more measure to reduce the risk of spread. So once again, we still need to follow all the other techniques, principles, rules that we've put in place in the past. Staying within your communities, staying within your households, staying within your zones, frequent hand washing, social distancing, which means staying at least 6 feet apart from one another. So those core principles absolutely remain in place. What's being added by the CDC and CMS and now by Episcopal Homes, what we're requiring is that everybody, when you're outside of your unit, so for independent residents, when you're outside your apartment, for those who are in our 2 nursing homes, though, when you're outside of your room, we're saying that you need to wear a mask, and staff need to be wearing a mask at all times that they are outside of their offices or their workstation. And of course, those providing direct care, they need to be wearing a mask all the time. And then of course, as I said, this homemade cloth mask, this does not replace PPE or personal protective equipment. The PPE is used by any staff when they are going into a known risk zone, or one day if we have a case. So please cooperate. Please cooperate. I did. When I walked from my office to where I'm standing right now at Episcopal Church Home, I wore a mask. So starting today, anytime you see me in any zone, you will see me wearing a mask, unless you see me in my office, then I won't be. Otherwise, I will be wearing a mask, and all staff are being required from this time forward to wear a mask. And residents, we're asking you to join us, okay? Please cooperate and make a homemade mask, or pay it, or be watching for added information from your managers or from the various ways that you get your updates for your communities. I will be putting out later today an updated memo in this regard, and I will be doing a call fire as well. So once again, this is one more measure that we're adding to the precautions to reduce the chance of spread. Lastly, I want to ask you, are you remembering the challenge I put out to you last week? Reach out to somebody. Reach out to somebody new that you think might really appreciate your connection, that phone call, or that social media outreach, or that FaceTime, because maybe they are feeling lonely and they would appreciate contact from you. Do that. Not only will they feel better, you will feel better as well. So thank you so much for your cooperation. Be watching for that update later today from me pertaining to the wearing of face masks. And until tomorrow at 1:30, wishing you a good day.